My name is Taylor Whitaker, and my other group member is Harkins, and we will be presenting the theory of illness trajectory. The first theorist that is coined for the creation of this theory is Carolyn Weiner. Carolyn has a bachelor's degree in interdisciplinary science, a master's and doctorate in sociology. She is a professor and research sociologist at the University of California School of Nursing. She is the publisher of many research and theory articles, as well as authoring and co-authoring several books. She has experience in studying illness trajectories, coping, and uncertainty. Because of her experience, she is considered a sociological and methodological expert. The next theorist is Marilyn Dodd. Marilyn is a registered nurse, doctor of philosophy, researcher, and professor. She is currently a teacher at the University of California at San Francisco. Her research includes self-care and symptom management pertaining to cancer patients and oncology and nursing. She is also a publisher of several books, studies, articles, peer-reviewed journals, and many editorials. She is also deemed as an international public speaker. The reason for the development of the theory of illness trajectory was to recognize and explore uncertainty as it relates to an illness trajectory in cancer patients, as well as the coping that is involved. It was also created to attach a sociological perspective on an illness trajectory to explore and understand disruptions in one's life caused by an illness. It was also created to understand one's physiological, psychological, and biographical conceptions of the self related to an illness. And lastly, it was to present the role of uncertainty and to understand the responses made by a patient in response to illness disruptions.
My name is Caleb Harkins. I'm going to be discussing the theoretical sources and empirical evidence. The series was developed as an expansion of the work by Strauss and Corbin, done in 1991. They developed it to address the pitfalls and the theoretical aspects as it relates to nursing. This theory is explained by empirical evidence gathered via interviews in a 6-month study of 100 cancer patients and their families. They did 3 interviews during the course of the 6 months on one volunteer of each person in the cancer patient's family. The data was gathered regarding the degrees of distress, their largest concern, and their satisfaction of the management of that concern. Weiner was involved, and she used grounded theory to reveal a trajectory, perspective, and a change over time. They addressed coping and other things that were addressed by Taylor previously. The primary source for this theory is titled Coping Amid Uncertainty, an Illness Trajectory Perspective of Change Over Time. This was published by Weiner and Dodd in 1993 in a Scholarly Inquiry of Nursing Practice, an international journal.
The nursing metaparadigm includes the person, environment, health, and nursing. The first is the person, and in this regard it refers to the wholeness of the patient. It refers to the client that is dealing that has the specific illness. It includes the elements of the person's life, which in this context is their identity, temporality, and body. As it relates to the person, the nurse must understand that the patient's illness and its consequences are what deducts from the patient's wholeness. The environment, this includes the patient's surrounding of family, healthcare professionals, and the places the patient visits throughout their trajectory illness. For example, this theory was created in relation to cancer patients. So one example would be that a cancer patient would join a cancer support group, which is a changing in their physical environment due to the illness that has come about in their life, which is the cancer. It also involves the client's new body or environment where the illness is now hosting itself. Health Chen and Kramer refer to this as the overall goal of nursing. As it relates to the theory of illness trajectory, health involves the nurse assisting the ill patient in achieving the maximum degree of health despite the illness present. This may involve effective symptom management or, in the best case scenario, eradication of the illness totally. The last concept of the nursing meta paradigm is nursing. And this requires the nurse to interact with the patient, family, and other healthcare professionals in order to show their care by assisting the patient in achieving their maximum level of health. It also requires the nurse to help the patient meet optimal level of health by providing knowledge, interventions, care plans, and collaboration in the patient's care. And lastly, it requires the nurse to initiate and facilitate coping, as well as being a resource for answers and guidance relating to uncertainties of the illness. Now discussed are the major central concepts and definitions of the theory of trajectory illness. The first is that the life of the person is a biography that is composed of their identity, temporality, and body. Identity is defined as one's conception of self. Temporality is the biological time reflected in the continuous flow of the life course events. It is the perceptions of the past, present, and possible future interwoven into the conception of self. The body, this involves all the activities of life within the body. The conception of self is based on one's capabilities to perform certain tasks and roles. Major central concepts and definitions include illness causes uncertainty in the identity, temporality, and body associated with the patient. Uncertainties affect the perception of self and social interactions. Activities related to one's illness are considered work. The patient, family members, and healthcare professionals are referred to as the total organization. There are also 4 types of work that are discussed by Ali Good and Tomey. These include illness-related work, and this is diagnostics, care regimen, symptom management, and crisis prevention. The second type of work is everyday life, and this includes normal daily activities such as holding a job, cleaning the house, and sustaining relationships. The third is biographical, and this is the exchanging of information and emotions and the splitting of tasks within the total organization. The fourth is uncertainty abatement, and this is the work done to reduce uncertainty. The goal of all work is to create equilibrium in one's life despite disruptions caused by an illness. Some major assumptions. The theory of illness trajectory includes physical components of illness and work done over the illness trajectory. The theory encompasses the total organization rather than isolating the patient. The patient is the center of the total organization, so their fate and management of the illness rest on the work done by the total organization, not just the patient's work alone. And lastly, the loss of control and uncertainty are major threats to the patient. Some theoretical assertions. Corbin and Strauss set the basis of the sociological context of the work of living with an illness. Due to the changes and disruptions caused by an illness over time, coping is very important and necessary in the illness trajectory. Coping is an active process that involves constant interaction by the patient with family, healthcare professionals, and external factors. Miner and Dodd discovered that family, finances, and healthcare professionals influence the levels of uncertainty in the cancer patients that were evaluated. Quick summary. The theory involves patient identity, temporality, and body that affect and are affected by each type of work done by the total organization. As illness continues, uncertainty remains. Coping is required in order to reduce the levels of uncertainty within the illness trajectory. And the overall goal of nursing is to adequately identify uncertainties and create management strategies for the total organization in order to reduce uncertainties caused by an illness.
All right, now we're going to talk about a schematic we developed to address the theory of illness trajectory. Weiner and Dodd don't have a schematic for this. There's just a section on concept and definitions with some tables involving uncertainty. So we developed this schematic. First, we're going to address the left side of the schematic, which is the conceptions of self. According to Allie and Tommy, the life is saturated in a biographical context, and so how you view yourself is based on three things that Taylor already talked about, but I'll reiterate. First is identity, which is in the middle of the green arrow. Identity is the conception of self at a given time that unifies multiple aspects of self and is situated in the body. So that's your identity at a specific time. The next is temporality, which is represented by the down arrow kind of as a progression throughout time. This is the biographical time reflected in the continuous flow of life, course events, and the perception of the past, present, and possible future. So that's the arrow with identity in the middle of that. And then the body, which is activities of life and derived perceptions based on the body. And that's the top blue arrow. And that relates over to the central worker and the total organization. It refers to them as a sphere in Allie and Tommy, so I did two circles. The total organization, which is everyone involved, the family, caregivers, and including the patient. And then inside is the patient or the central worker, which we're going to focus on. There's four aspects. These are called work. And it's how the patient copes with their illness along the trajectory. First is illness-related work, which is doctor visits, diagnostics, symptom management, the care, crisis prevention. Next is everyday life work, which is just what you would do every day, having a job, taking care of your family, keeping a household, relationships, and past recreation. Next is biographical work, which is the exchange of information, emotional expression, and the division of tasks through interactions with the total organization. And then last is uncertainty abatement work, which is activities enacted to lessen the impact of temporal body and identity uncertainty. So these are coping mechanisms, and that's kind of one of the focuses of this theory.
Some of the logical forms that were used in the creation of this theory. Inductive reasoning was the primary form of logic used. Weiner and Dodd used the composition of interviews and the formulation of the theory's main focus, which is tolerating uncertainty. In addition to the interviewing results, systematic coding processes were integrated to further explore and define uncertainty. The theory was commonly reported and successful in advancing knowledge about illness trajectories. There were no flaws identified.
All right, now we're going to talk about research, education, and advanced nursing practice. Weiner and Dodd developed this theory to expound on the existing nursing research on illness and trajectory. This was studies by Strauss and Corbin in 1991 on illness and that trajectory, and they wanted to have a better concept of nursing and its relation to coping and whatnot. Education is provided by Weiner and Dodd through seminars, consultations, and course offerings. This is used mostly in cancer centers by cancer nurses. They stated in 2000 that future reprinting of this theory for nursing texts will contribute to the recognition and popularity of this mid-range theory. Advanced practice nurses are also able to use this theory to provide interventions that decrease the amount of uncertainty related to a patient's illness by in turn understanding those uncertainties and how these patients go about coping with. We're going to look at a case study that we developed for this theory. Okay, Mr. Peters is a 36-year-old male who has recently been diagnosed with nodular sclerosis, Hodgkin's lymphoma, and is about to begin his second month of chemotherapy and radiation. He lives with his wife, Mrs. Peters, who is an elementary school teacher and continues to work full-time and has 2 children who are 5 and 7. Mr. Peters is a staff member at a local church, which is very supportive and allows for paid time off when Mr. Peters is too weak to work. The FMP at the local cancer center has noted that Mr. Peters, who seemed depressed and withdrawn during his first month of treatment, seems to be making jokes about his illness and comparing himself to others he has known with the disease. Says that things could be worse. His wife now seems to be stoic and straightforward with her questions about prognosis and the adverse effects of treatment. Okay, and here's the implications for advanced nursing practice regarding the case study. Mr. Peters is using reinforcement comparisons. This is a type of uncertainty abatement work. It's used to make his illness seem less serious and to give him a greater sense of control during the disease trajectory. Mrs. Peter, on the other hand, is covering up her emotions, which is used often to protect her family from her true feelings and her true emotions. The FMP can now use this information from the case study and the work done by Weiner and Dodd to provide appropriate nursing interventions and recommend other uncertainty abatement works such as support groups and support networks. These are used to establish a place where people are comfortable expressing their true emotions, and their emotions are expressed in a supportive atmosphere, and they can share their feelings and have positive support from other people in support groups and support networks. All right, and in summary, Weiner and Dodd developed this theory in 1993 to provide a new way of understanding how patients and families deal with the uncertainty of an illness, as well as the types of work that are used to ease this uncertainty. This theory can be used throughout the scope of nursing, and it's used to guide interventions with families dealing with certain illnesses to provide better outcomes and easier transitions. Thank you.